My name is David Musoke. I work at the School of Public Health at Makerere University, and I'm also the Uganda lead of the partnership between Makerere University and Nottingham Trent University that is leading this particular work, working with the Buckinghamshire NHS Healthcare Trust, together the Ministry of Health as well as Entebbe Hospital. This work has really taken us to places. We have been in Wakiso for a long time, but recently, as you heard, we've been in Nakaseke, and now we are here in Mpigi. This work has been going on from 2019, that is on AMS, but before that, we were doing a lot of work around community health in Wakiso, working with the Nottingham Trent University. But when we learned of a funding call from the Commonwealth Pharmacy Association, we felt that we could broaden our work beyond community health and go into antimicrobial resistance. And that's where we started doing some small work in Entebbe Hospital initially, but then broadened up to other health centers, Center 3s, 4s, 2s. We have trained some VHTs as well on antimicrobial stewardship. So
the partnership that has sent Natasha and Arash is part of the Commonwealth partnerships for antimicrobial stewardship, because the objective for the CwPAMS is to make sure that we leverage and provide opportunities for bilateral learning between the UK and some African countries. So CwPAMS is in Kenya, Uganda, Zambia, Sierra Leone, and Tanzania.
I've been very taken aback by everybody's participation and their attitude towards this subject. Whilst a very serious matter, I noticed that in true Ugandan style, you're able to have a laugh and a joke about the matter as well. So it's something that we need to take back to the UK. This project is not just us teaching you, but it's us in the UK taking back practices that you have here back to the UK as well.
I'm very grateful for the visit to the Gombe Hospital yesterday. I took a lot away from that. We do have differences as nations, but actually we do have some similarities. So there is a lot we can learn from each other. So similar to Arash, I'm going to take back to the UK, hopefully try and inspire my juniors to have a bit more of a positive attitude. Things can be done and change can happen just with a bit of enthusiasm. And I think we do sometimes lack that in the UK.
You know, there's always new knowledge that we can always add on. And I'm so thankful that you've been very good participants. For me, as a lecturer, as a pharmacist, when you see people asking questions, discussing, it means that there's a lot of interest.
This meeting has brought a number of people from different walks of life, I inclusive from the veterinary background, with my team that is actually here. It is a good indication that we are on a right trajectory, because when we talk of AMR, it calls for concerted effort. I have to confess here that on the human side, it's a little bit actually okay, but on the side of veterinary, we are doing a lot of syndromic treatments, which is likely actually to even make it worse if we are to fight AMR going forward.
So with all the knowledge we've got today, I think we are very ready. I have learned and relearned a lot from my human colleagues. We've had a lot of debates, but I also had to back down because I always remember that I'm not a human doctor. And sometimes I would also shut them up because there are also some differences. But end of the day, we are doing all this to share knowledge, which should be used for our day-to-day practice to make our community better. So we thank you so much.
For the years I've been in Butambala, that are now like 10, this is the first of its kind that I've participated in. So it means it is a huge step. We all know that we are on a time bomb of antimicrobial resistance, and I'm urging all the participants to at least implement one thing you learned today.